Hi there! Let us know about anaphylaxis. Let us know first the definition of anaphylaxis. The term anaphylaxis was first coined by Portier and Richet in the year 1902 when a second vaccinating dose of Z anemone toxin caused a dog's death. The term is derived from the Greek words ana, meaning up, back, or again, and phylaxis, meaning guarding, protection, or immunity. Anaphylaxis is a serious, systemic hypersensitivity reaction that is usually rapid in onset and may cause death. Severe anaphylaxis is characterized by potentially life-threatening, compromise in breathing and/or the circulation, and may occur without typical skin features or circulatory shock being present. What are the causes of anaphylaxis? The common causes of anaphylaxis are first, food allergies, such as peanuts and tree nuts, fish, shellfish, wheat, soy, sesame, eggs, and milk. Second, certain medications, including antibiotics, aspirin, and other pain relievers available without prescription, and also intravenous contrast used in some imaging tests. Third, stings from bees, yellow jackets, wasps, hornets, and fire ants. Fourth, latex products such as gloves, medical products, and tools.
For the simplified pathophysiology, anaphylaxis is a sudden, potentially life-threatening allergic reaction that involves multiple system dysfunction. It is caused by a massive release of inflammatory mediators from mast cells and basophils into circulation. These mediators are normally responsible for the body's protective response against infections or injuries. They dilate blood vessels, increase the permeability, allowing immune cells to seep through to arrive at the site of infection. But when released systematically, they can lead to extensive vasodilation and smooth muscle spasms, causing blood pressure to drop and airways to narrow to a dangerous level. Common triggers include certain medications, foods, insects, animal venoms, and latex. Symptoms typically begin within minutes to 1 hour of exposure and may include widespread itching, hives, swelling, wheezing, difficulty breathing, nausea, abdominal cramps, diarrhea, dizziness, a fast heart rate, and low blood pressure. Shock may develop within minutes. Patients may have seizures or faint. There is also a late phase response, usually less severe, within several hours to 1 day. Classically, anaphylaxis is defined as a type 1 hypersensitivity which involves immunoglobulin E, IgE, and only occurs in pre-sensitized individuals. Patients must have previous contact with the allergen, which produced no symptoms, but during which the body had produced IgE antibodies against the allergen. IgE molecules bind to their receptors on the surface of mast cells and basophils. Upon re-exposure to the same allergen, or sometimes a similar allergen, the allergen binds to adjacent IgE molecules, bringing the receptors together, triggering a signaling cascade that includes the release of inflammatory chemicals.
Diagnostics. For the airway management, in anaphylaxis, the airway may rapidly swell and close. Even when the airway is not blocked, airway secretions can lead to extremely labored breathing, and the patient may unable to clear their own airway. Endotracheal intubation can preserve airway patency, and this almost always require a quick and efficient suctioning. Tryptase test. It is a useful indicator of mast cell activation. The tryptase test may be used to confirm a diagnosis of anaphylaxis. Anaphylaxis is primarily diagnosed clinically, but a total tryptase may be ordered, along with a histamine test to help confirm anaphylaxis as the cause of someone's acute symptoms. Skin prick test. It is widely used to demonstrate an immediate IgE-mediated allergic reaction as a major diagnostic workup in the field of allergic diseases. SPT is cheap, easily performed, and provides a response within a few minutes. This test is generally considered a very safe procedure. For the nursing management, the nurse has an important role in preventing anaphylactic shock. Communication is an essential part of the assessment, and if the patient cannot do so, communicate with your significant others. For the nursing assessment, assess any kind of allergy. The nurse must assess all the patient for allergies or previous reaction to antigens. Assess the patient's knowledge. The nurse must also assess the patient's understanding of previous reaction and steps taken by the patient and the family to prevent further exposure to antigens. New allergies. When new allergies are identified, the nurse advises the patient to wear or carry identifications that names the specific allergen or antigen.
For the nursing interventions, monitor client's airway. Assess the client for the sensation of a narrowed airway. Monitor the oxygenation status. Monitor oxygen saturation and arterial blood gas values. For focused breathing, instruct the client to breathe slowly and deeply. For positioning, position the client upright as this position provides oxygenation by promoting maximum chest expansion and is the position of choice during respiratory distress. For activity, encourage adequate rest and limit activities within the client's tolerance. For hemodynamic parameters, monitor the client's central venous pressure or CVP, pulmonary artery diastolic pressure or PADP, pulmonary capillary wedge pressure, and cardiac output or cardiac index. Lastly, monitor urine output. The renal system compensates for low blood pressure by retaining water, and oliguria is a classic sign of inadequate renal perfusion.
So what are the things that we should know and teach our patient and the public? In anaphylaxis, patient education includes awareness, detection, and prevention. The nurse should educate the client regarding anaphylaxis, its cause or etiology, and the common signs and symptoms which need immediate intervention. First, the nurse should advise the client to see an allergist. Anyone who has experienced an anaphylactic reaction should be evaluated by a doctor with specific training and experience in the diagnosis and treatment of anaphylaxis who can help you to prevent recurrences. Board-certified allergists have such training and experience. Second, testing to determine the cause or trigger. It is important to confirm the triggers of the anaphylactic reaction. Allergists can perform and interpret skin or blood tests to confirm specific anaphylaxis triggers. Third, avoiding triggers. When a trigger has been identified, the individual should avoid it. However, avoiding some triggers such as common foods can be difficult.
Foods. If an individual has experienced an anaphylactic reaction due to food, the nurse should educate the client to eliminate that food from his or her diet. This requires that the patient should read and understand food labels and ask about the preparation and the content of all foods, especially when eating away from home. This recommendation applies to snacks as well as to meals and to everything that the client plans to ingest, not just the food that are most likely to contain the trigger. More information about the allergy treatment and prevention is available separately. Insect sting. People with an allergy to stinging insects like bee, yellow jackets, wasps, hornets, or fire ants should avoid locations where these insects are being seen. And a course of allergy shot is recommended for everyone who had an anaphylactic reaction after an insect sting.
For the medications, if the client has an allergy to a medication, he or she should learn and record all the different names of that medication and the settings in which they are likely to encounter it. Encourage the client to ask their healthcare providers to note their allergy in their medical record. Lastly, wear a medical identification. People who have experienced an anaphylactic reaction should consider wearing a medical identification bracelet or similar medical identification tag. If another reaction occurs and too ill to explain the condition, the words anaphylaxis or anaphylactic reaction will help emergency responders provide prompt and proper care. The tag should include a list of known allergies as well as the names and phone numbers of emergency contacts. Some devices provide a toll-free number that emergency medical workers can call to find out a person's medical history, list of medications, emergency contact numbers, and healthcare provider names and numbers.